fine with a pillow. I'd prefer that, but some patients are in with us because they have pain, and so you can put a small pillow underneath their belly, like we talked about in positioning, to make the patient comfortable. But from here, what I'm going to do is now my hands, when I actually go to do, again, now I'm skipping that whole active, passive, passive. I'm just going to do it for sake of time. I'm going to feel at their ASIS for extension. This one's really hard to get everything lined up and hold their leg. So I'm going to get underneath his thigh, and I'm going to make sure that we don't do any knee flexion. What happens if I knee flex? The quads. Which quad?
Rectus femoris.
The rectus femoris, because the other quads don't cross the hips, so they're not two joint muscles. So from here, what I'm going to feel for is when I start to get an anterior pelvic tilt. So right about there. Now his leg's too heavy for me. So I may, if I was really concerned about getting the most accurate measurement possible, come in and get an assistant. But my landmarks are the same as they were for hip flexion. I can't see this. Can you come towards me a little bit?
When you're in the clinic, do you do this? You don't take their clothes off. I mean, like
Yeah.
I know that was a problem for the practical.
For the shoulder.
She had a really high tank top on and finding her spice process. I mean, range of motion.
Right, and that was the patient that normally she could have easily taken off her shirt and she felt uncomfortable, so I would have a patient take that off in the practical. In this area, technically we would want skin on skin, but in real life, I'm probably doing 15 measurements in a row, and I'm just moving people round and round. So I'll talk to Dr. LaRosa, and we'll come up with what we think is our consensus. He went to the DRC real quick, but on as far as this practical, so we don't, we'll just come to a consensus. So let's leave it at that for now. Okay. But in real life, no, I probably wouldn't while I'm taking these measurements. If I were concerned about more of my clinical diagnosis and figuring out if he had a bursitis or a piriformis issue, then yeah, I would be draping and getting skin on skin. But as far as the measurement goes, practicality. But of course, we want you guys to learn the standard, and then you can learn to deviate when you get into clinical practice. So we said, in the shoulder, take the shirt off, find your landmarks, do your measurements. So let me come back to how we want you guys to do it on the practical. But standard would be to expose the landmark. All right, so his leg's heavy. I'm not going to, go ahead and relax. Here you go. So I need to find ASIS right about there. I'm not that strong. His leg's heavy. I got to do this quick because my arm will give out. And I'm going to get like 9 degrees. So normal, but